Singapore announced yesterday that it's making mental health and well-being a key priority, and it laid out a raft of measures, including raising capacity at hospitals and ramping up the number of public sector psychiatrists and psychologists.
What will this focus on mental health mean for the jobs market? We discussed this with our guest this evening. Jaya Dass is Regional Managing Director of Permanent Recruitment at Human Resource Consultancy, Randstad. Thanks so much for coming in this evening. Let's start with the practice of employers asking job applicants to declare if they have any mental health issues. Now, I remember when applying for jobs, they will ask you, it's a general health checkup is one thing, whether I have ever been, imprisoned in another country, got into criminal trouble. Yeah. These things are asked. But now, is mental health, is that something, a legal requirement when companies employ people? Are they legally required to ask if you have had mental health issues in the past? And if it is or if it is not, do you think it should be a requirement?
Companies have a duty of care towards their employees. So when they check to ask if you have mental health conditions or if you have physical conditions they should be aware of, it's a generic statement to say, is there anything you need to declare? Mental health is certainly, or rather the need to declare it is not a legal obligation, nor do companies single in on one specific topic to say any part of particular physical health that you need to declare. It's a general conversation. For a lot of people, they might not even be diagnosed and so aware of it. So it's not something that people would come out openly and say what it is unless it actually impacted them in some sense of it or it impacted the job that they were doing. So epilepsy might be a condition, say, for example, that if you are aware you have it, you would then want to tell your colleagues, or you have a condition, say you have an allergy, that somebody would need to take you into the hospital or so on if you have a reaction. Those are conditions that your work environment ought to know about so they can help you with it. But mental health is too vague a topic and not a full, I would say, an impediment in that sense that says you need to declare it and such, but it's certainly not a legal requirement.
Well, given that our attitudes towards mental health and well-being are shifting in Singapore, over the past few years, really, and now we're speaking a lot about it more this week, because it's been discussed in Parliament too. If a person were to make that declaration for whatever reason and were to say, well, yeah, I do have a mental health issue, what are the chances of that declaration, impacting their ability to be hired or rejected for a position? I mean, there is a perception that it might actually impact them in a negative way?
There's still very much a stigma, unfortunately, Don, attached to it. And I think there's a lack of education and public understanding. Way back in 2019, pre-COVID, the World Health Organization said about 15% of the working age adults basically were diagnosed with some condition of mental disorder. Not even just general mental health issues, but a mental disorder. So clinically diagnosed. It's estimated at the moment that roughly it costs about $1 trillion per year in loss of productivity from people who have issues with anxiety and depression. So it is a growing number. I don't think anyone is immune to bad mental health. It's a spectrum of an issue. You could be clinically diagnosed, and such an instance, if the clinical diagnosis then means that you have some conditions that would stop you from functioning in full capacity in a job, disclosing that then might sort of hinder your ability to function in the role. So if stress and pressure is a trigger of mine, and I pick a job that actually does that, it's a bad match. So I think organizations are screening for that to make sure that there's no risk to the employee and to themselves and the working environment. There's a duty of care to all parties. So I think it comes from the best place, more than I doubt if you can perform the job, unless it's really visible and quite seriously at a clinical level. But all of us at some stage of our lives will have some version of mental health issues, and it's not static. You have a good day or a bad day.
How do you strike a compromise on that? It's a duty of care not just for your employee, but for yourself as well. As an employer, I want to get the best value for my money. And I have no idea, maybe you're okay in some situations, maybe in others, and in a good job, there will be stress. What happens when you cannot function and are paid good money to hire someone as capable as yourself?
I think organizations are beginning to understand every individual has episodes that they need to deal with when they go through stress, whether it's caused by work or a personal situation. And these days you see HR policies moving in the right direction. You have employee assistance programs, You have wellness being initiatives in the company. You have mental health days. You have meeting-free Fridays or Mondays, so on and so forth. So there are a lot of initiatives that are already placed in organizations with the recognition that people have a negative impact on their health from what happens with their mental health. So in that sense, I think what you start to see more and more is companies recognizing that it's at a broad spectrum and they do need to provide support. And actually for mental health, people with diagnosed mental health, work is actually a good thing for them. It keeps them sort of conditioning in a certain way. It gives them a sense of responsibility, a purpose, some order, structure. So that's a good thing. But when it tips over and you don't have self-care, you're not in a supportive environment, you don't have empathy from your leaders, you're not in an environment that promotes your health or your wellness in general, then you are in the wrong environment, or you shouldn't be in such an environment that triggers you. So there's a duty of care that the individual needs to take with themselves to match themselves to a place, an organization, as well as a function that suits them to the best of nature. And very often, most people are undiagnosed. You wouldn't know it till you have an episode or something triggers it. And it could very well happen in the job itself.
Well, that being the case, I mean, I'm thinking that companies are doing a lot. You know, they are, and at different levels as well, as you say. If there were something that they could perhaps improve upon, I mean, for you, what would you want to see? Because you mentioned empathy.
Yes.
It's really hard to kind of, you know, sort of institutionalize that, isn't it?
If you were to read further on mental health, people who maybe suspect that they have those issues will usually be grappling with them for a very long time. They remain undiagnosed and maybe even in denial and refuse to seek that sort of help and support. In Asian climates or contexts and cultures in particular, the stigma is so high, you don't want to be seen that way either with yourself. So having said that, I think the most important factor is to have a supportive manager, and for organizations to coach leaders and managers. How do you cope in such a situation if you are at that point of maybe sort of offering that help, or you see an episode, or it comes under your care, and handling those conversations, having that empathy, knowing what to do with the person and not triggering them further. These are things, and if you're faced with something the first time as a leader, you might not be in the best position possible to deal with it. On hindsight, you'd reflect and said, I could have handled that better. But if organizations train you, support you with that, and help you recognize that it's more prevalent than people think, that's the best course of action you can take to provide a positive, supportive environment for everybody.
Thanks so much for coming in this evening, for sharing your insights with us. Ms. Jaya Das there, Regional Managing Director at HR Consultancy, Randstad.
Thank you.